my name is Annika, and welcome back to Envisioning Your Path with Dr. Lee. Dr. Lee, what advice do you have for students tackling their first case report?
So, writing a case report is the best way to get an introduction in not only how to start medical writing, but research, and just getting your feet wet in terms of a clinical exam and what the abbreviations mean in ophthalmology, and just how is this thing structured. A case report is a report about a case, and so it's not that difficult and can be done by a first year. Even someone who has limited clinical knowledge can still write up a case. The important thing about a case report is it has to be novel. And so what we're asking ourselves when we're asking the question, is this reportable, is this is the first, or this is the only report, or this report is the first to describe the finding or the first to demonstrate the imaging. So we're trying to establish novelty, and so that is the litmus test for this case report. Is it reportable? Is it the first or the only? What does it actually add to the literature? Being the 10th example or the 50th example of something is not going to get published. The second thing with case reports is you have to follow the instructions to authors. And every journal is different, but one of the very first things you're going to do when you look for a case report is figure out what the instructions for authors are for that particular journal and what are the requirements of that. And then you should use a template. So for us, we give all our medical students a template. So there's a case report template, there's an iWiki template, so that you don't have to reinvent the wheel. You are following exactly the template. And when you look at other case reports, we ask our first authors for writing case report to look at other case reports first before they even get started, so that they know what it looks like. And then we give them the template, and then we tell them to follow the instructions for authors. We make them answer this question right here, and then it's my job to help them with the editing and make sure it's reportable. The last paragraph of the case report has to have the heuristic. The heuristic means what is the teaching value of this case, and so it follows a standardized format. Clinicians should be aware of, insert your heuristic, whatever you're trying to tell them, and then it ends with future work is necessary to determine whether our observation is generalizable or applicable to whatever the situation is. And so you can see it's got a format and a structure that's already been decided, because there are many case reports in the literature, and you're trying to get your feet wet. And so a case report is a really great first introduction for a medical student, especially a novice person like a first or second year medical student. And then you generate a hypothesis from this case report, because hypothesis generating is what case reports are for, and hypothesis testing is what for larger studies are. And so it's a really great segue to take a hypothesis that's novel that you found with a patient and turning it into something meaningful. But you have to crawl before you walk, and you have to walk before you run. So this is the crawl. You have to crawl towards your first case report.